I want to cover a few things, maybe answer some of the questions that many of you may have.
Great.
So I want to start by saying that all the Red Cross service delivery for our clients are the same and are in place. What has changed is how we delivered our service to our clients within the COVID environment. So what I want to discuss, present a little bit of how DST will work within our current COVID environment. I think that's a big question of many of us. Note that what I present will be adjusted on a case-by-case basis depending on the operation. So that literally about us building the plane while we're flying it, it's very true at this point. So it's just some guidelines. So DST will continue to provide technical support for the disaster operations. All the processes, everything that's written in the DTPs are still valid and are expected to be implemented in the field. And as a DST lead will be assigned either virtually or physically to all operations, who will work with the log AD and DST at the dock for all DST needs. So that person is your first point of contact if you're working on an operation. DST equipment will be provided to the DST's DRO staff as directed by RMS or the assigned DST on lead on the job. Again, this is all changing, so I'll get into that later as to how it's different. And all the equipment will be shipped from the LFC, either to a site that will have equipment or to the individual who is working virtually. So for and we're all the volunteers will be either physically or virtually deployed, following all the COVID-19 safety protocols. The DRO footprints are going to be a lot smaller, the HQ, if there is an HQ. And again, it's going to be a case-by-case basis based on the operation. So DST volunteers should have in their mind whether they're willing to deploy physically or they want to only be virtually deployed. So in a physical deployment, that means you get sent to the operation. And again, what dictates that depends on the operation. So that lead, the DST lead, will be the point of contact and should be listed on the IAP. The first responsibility of anybody deployed to an operation is to contact the job director to make sure that they have good Teams, audio, video connection. You need to do a test, make sure it works, whether the job director is virtual or physical. You need to make sure that they can access Teams, they can have good audio, and they have good video. And this is because, you know, NHQ is going to be expecting them to deliver information and using the Teams for this. So you must test this, and you will set this up and set up a Teams meeting with the job director. That is the first priority. You will set up, again, just no different, the DST equipment in a congregate or non-congregate setup, DRO facilities, and you will receive and maintain, this is again physically, if you're physically deployed, you will receive and maintain the inventory of all the DST equipment, and no equipment should be sent from the HQ location. So if you get from the AD says that we have Mary Jane who's going to be working in a shelter at this location, you are not going to ship that equipment to that person. You will submit the request to DST at the dock, and they will have it shipped from the LFC. Now, normally that shouldn't happen when on an operation, if they do a staff request, RMS is going to process it, and RMS will ask the question of whether they need equipment and arrange that to be done. So again, physically, you're going to do what you normally do. However, the difference is you also have to not only maintain the physical equipment that's on site, you will have to maintain inventory of the equipment that's assigned virtually. And I will share this in a minute here. We have a tracking spreadsheet, COVID spreadsheet, and you're to keep track of that information and make sure that all the equipment, physical or virtual, are returned to the LFC as staff out process. You will attend the daily meetings, and you will complete and submit a daily situation reports along with the tracking spreadsheet or the sit rep out of TIMS to dst@redcross.org. Just a few more items, and then I will share the spreadsheet. The virtual deployment means that you are not at HQ. You are not physically at a location. However, you will still be the DST lead, and you will still be the point of contact enlisted in the IAP. Again, your first priority as a virtual DST deployed volunteer is to set up, contact a job director, and make sure that they have good Teams and audio and video connection. And again, you must test it, set up a meeting, absolutely has to be on and working, and troubleshoot that. You will also provide support and service to any staff members that are deployed, assigned to this operation, either by phone, email, or Teams. Basically, you're going to be the help desk. You will be helping them. You will be troubleshooting all the problems and issues that they have. You'll supervise any staff, any DST staff, whether virtual or physical. You will maintain the inventory of all the DST equipment that's assigned to the operation and making sure that it's returned to the LFC. Again, the tracking spreadsheet will help you maintain that. You'll make sure that all the equipment is returned. So with virtual, you need to know that a virtual staff member got equipment. You need to follow up that staff member returned it. And that's a big part of it. You will attend all the daily meetings, and you will submit a daily sit rep and the tracking sheet. So let me share my tracking spreadsheet with all of you. Somebody tell me when you see it. Yes?
Yes, I can see it.
So you can see that the virtual DST tracking sheet, it will automatically populate the date and the time of when you open it. Under the status, will have, you will say whether they're active or should work, but it's not working. But you're going to say it's active, transferred, or returned. Is there a 6409 and what equipment? So that I'll fix that, but that's all. So you're going to have their name, their phone number. Was there 6409 that you saw? Obviously, if they return, if it's shipped directly to a virtual worker, you won't have seen that. When was that? When did that happen? When did it get requested? If you know this, again, and then the ID of that. Then ship from the LFC. You will get a shipping report, and you will know when it was shipped, and you will get the tracking number, the FedEx tracking number. You will enter that. When was the equipment received? So you might have to contact a virtual worker. Did they receive it? Ship from the end user when they're done. And when you talk to that person, you might find out how long are you going to be on this operation. They may not know, but they may know also. Then you're going to enter ship from the end user, because they're going to request a shipping label, and they will have a tracking number for that. And then, yes.
Tina, it's Matt Hackman. So when you do ship FedEx, you can have email notification for all the shipping and receiving and stuff. would we be added to that so that when it's shipped from the LFC, we'd be copied on that and we'd see when it was delivered? And likewise, when they ship it back, then tell them to copy us on that so that we would see when they got it to FedEx and when FedEx delivered it to LFC.
We will give you the shipping report with the tracking number, and you can track it. It's not set up. We could look into that, but it's not correct. The problem is a lot of times the equipment's shipped and we don't have a DST lead yet, right? So it's kind of hard to do that. So we will,
Understood. Thank you.
We'll make sure that you get the information, all right? And then when it's received back at the LFC, again, that's that's a good suggestion, and we'll see if we can work that out so that you can get this information about when it's received back. But the most important thing is you don't want to be at the end of the job running around trying to find out, we're telling you that person didn't return your equipment. So that's kind of my presentation and information for everybody. If you have some questions now, we'll entertain some questions.
That's great, Tina. Before we dive into other questions, somebody was asking about, somebody needs to mute their microphone, somebody who's breathing very heavily. So thank you. Let's see, Jean had asked, oops, why isn't that opening for me now? Oh, I switched to people instead of chat, that's why. Jean said, when the equipment is being shipped, is it going directly to the shelter? Is that what you said?
Yeah, it's going to the shelter. It's assigned to a person. It is not assigned to a place.
Okay, so it would get shipped to the shelter if it was for somebody who's working at the shelter.
It would be
no, Susan, let me jump in here for a second to clarify, please. Okay, so there's a lot of stuff changing, guys, and I'm not going to take up a lot of time because I know we have some other questions in the queue. But ever since the COVID environment started, the end of February, beginning of March, and we've had operations beginning with the series of tornadoes that occurred across the Southeast. Each job has been a little bit different, and we're evolving, and Disaster Cycle Services is adapting to this new world. It's not all the same. We've ranged from virtual deployments of 80% of the crew with 20% on the ground to recently operations that have had a 50-50 split. So for those people who are assigned virtually, who are working from home, when they go through the assignment process, they're asked some questions by RMS, including, do they have or need a laptop? Do they have or need a telephone? If they need a laptop and or phone, that is shipped directly to that person's house where they're going to be working from. So you don't have to worry about, the job is no longer going to be just processing 6409s for the bulk of the time in the headquarters like we used to do prior to this. In some cases, we'll have, even if it's non-congregate shelters, we may actually be needing to do some support on the ground in a hotel where we're putting people in different hotel rooms. So there's a lot of different scenarios about that. We'll talk more about that on the next all hands call, but that equipment's going to go directly to the people. And we're trying to put together some information for you guys. There's more to come. Like I said, it's evolving as we speak. So all that we ask is for your patience and adaptability and flexibility, because every job's going to be a little bit different, at least in the foreseeable future. Okay, I believe we can go to Lee Maury has a question.
Yes.
Let me unmute her. I contacted my divisional RMS lead just to understand how all this will look from her point of view. And she gave me a subtle but perhaps an important distinction, which was that RMS only deals with people who are deployed from out of the region. How they work, whether they're going to work remotely or work in person, really didn't matter. And so RMS, at least according to this person, was not planning to have interaction with people from within the region who are going to be working at home. They were only going to be having interaction with people from outside the region regardless of whether they're going to be working on a telephone or working in person. So that the distinction that they were making was not based on whether they were working virtually or physically, but rather in region versus out of region. And so from there, I went and checked with my my regional deployment lead and said, "So, are you tied? So, are you prepared to deploy equipment? Are you directly? Are you prepared to ask the same questions that would expedite equipment being delivered directly to homes?" And the answer was essentially they really didn't know anything about it. So help me there.
Yeah, so a couple of things real quick. It hasn't been the same way on any given 2 jobs. What we'll do is we'll circle back with RMS at headquarters and we'll get some clarification on that and we'll address it at the next all hands meeting. Okay?
Thank you. Before this weekend?
Thanks, Lee.
Okay, Chuck.
And I just want to emphasize Tina answered a question from Dave there. And I know I've heard people talking about this, that there have been problems in some of the past responses where people have tried to keep equipment to hand on to the next person taking over. And you really shouldn't be letting them do it that way. They need to send it back to the LFC and then a new request will be put in for the new person.
I'm going to jump in there for a second, Susan. This is Cindy.
Do.
And when people send in a request for returning equipment, I always make it a point to copy the DST lead, as I made a note in the chat there, that you will get a copy. So when that package is tendered, you will know that that person did return the equipment. And then you get a notification also from FedEx when the package has arrived back in Douglasville. And I usually copy the DST lead on the job when a virtual worker is getting their return label. So you have that tracking number that you can follow also. And I do follow up with our DST leads if someone has not returned equipment yet and it's like a month later and that equipment is still out, the label is still there. So there's a lot of moving parts to this of getting the equipment back, but I do make a very diligent, almost too diligent effort of making sure it gets returned.
Thank you, Cindy. Lee, your hand's up. Did you have another question? He put his hand down. Okay. Any other questions?
Go ahead, Randy.
I understand the virtual we're supporting at home. My question is, how far do we go if we doing support at home? Do we still follow the DST procedures, or do we? Because the reason I'm asking that, because you have a lot of personal equipment and going to be using virtually. So where do I stand as a support person? How far should I go to support them at home?
Okay, Randy, if somebody comes to you and says, I can't connect to my internet, do you think you would help them with that? I mean, you can help them try to find their internet on their at their home. I mean, the DTPs, you know, in terms of how to connect to the internet, we have a process. If it was our network, we would do the same thing with the person at home. But if it's a problem with their internet and their situation, then that you don't go to their house and you don't help them. That you don't do that. If they need connection to their printer, you're going to go through the processes of how to set up and connect to their personal printer, just like we would do, you know, the steps of, you know, in control panel and all that. Does that kind of answer your question, or do you have a specific situation that you think it's outside of the realms of DTPs?
No, I just want where we stand here. That's all.
Did that
So,
answer your question?
For the good of the group, Tina, if you don't mind, just to clarify that a little bit more, the difference is that typically, and again, we can never say never because every job's been a little bit different since this started. Typically, we don't have a headquarters anymore. So you're not in a room with a bunch of people where you can literally be standing over their shoulder trying to help them out. You're doing it via phone or email or whatever, Microsoft Teams, whatever means necessary. You're still trying to provide, you know, the same levels and types and kinds of support that we normally do within reason, of course. As Tina would said, you're not going to go to their house to do that, but which you can do over the phone. You're just doing it remotely. And this is more of a one-on-one with somebody else who's remote, as opposed to being in a headquarters or MARC or district office type of environment.
Yeah, thanks, Chuck. I was going to say too that idea of the remote support is partly why we've been emphasizing the use of Teams. So you can use that for a video call with someone to do a help desk support kind of call over Teams.
You good, Randy?
Yes, thank you.
Thanks, buddy.
Okay, Saroj says she has a question about SharePoint. We'll see if anybody can answer it. If not, we can follow up with you afterwards.
Yeah, I typed it in. Can you all hear me?
Yes, go ahead.
Okay. Yeah, I typed it in. So I'm secretary of the ham radio ARC club out here in Phoenix, and we're trying to give people access to a bunch of different documents. Oh, okay. Well, Steve just answered. Okay, so that's too bad. Well, we're going to develop our own sideline website then. Thanks.
Well, actually, I will modify Steve's answer a little bit. When somebody is on a DRO, they will have a DR-specific email address that will let them access the team that is set up for that DR. But if you're talking about accessing it in Blue Skies, then yeah, that's going to be different.
Okay.
It's
too bad. I think, you know, I looked at our membership. We've got about 50, I think, maybe 40 members, and 1 out of 4, maybe 1 out of 5 have an ARC.org email, and we've got a lot of documents, as you can imagine, manuals for every type of radio, and we're doing a lot of DMR work out here and exercises and repeater work, et cetera, et cetera. So it just seems, I just want to make the point that from an organizational perspective, it's really depriving the Red Cross of being able to share that kind of thing, because we're going to have to build our own private website.
Well, Saroj, you and I should plan a time to talk about that, because there are some other options that we can look at, sharing some of that material in Volunteer Connection maybe, or on the Exchange. So I wouldn't rule that out yet and start building your own site until let's talk about some of the other options.
Yeah, someone here, Larry Buchanan, did put a whole bunch of documents into Volunteer Connection. They all disappeared one day because someone decided to change it up and never mention it to anyone else. So we're real reluctant to do that again.
Okay,
Yeah,
we can talk. The
same thing could have happened just as easily on SharePoint. So.
You know, we're trying to focus on a DRO environment at this time, but for a non-DRO environment, there are some other repositories that, you know, might be a good option for you. And Susan and I can talk about that offline with someone who's maybe a little more fluent in those repositories like Google Docs or something like that.
Well, and I also know there is already some radio information on the Exchange. So that would be one place we could look at too, maybe putting some more documents there. So yeah, Saroj, let's talk.
Let's touch base later.
Yeah,
Thank you, Susan.
Sure.
Okay, bye-bye.
All right. Okay, so we have, you know, this is a 30-minute call, so we have a few more minutes. It's your chance to ask any questions, and if we don't get to it and you think of it later, you're welcome. I will type my email address in there, or you can write to DST at redcross.org, and someone can address your question.
And Tina, while we're waiting to see if there are any more questions, I wanted to share something that you mentioned about the first duty when they're on a DR is to make sure that the job director has good access to use Teams. And there is some information that I added to that toolkit that I shared the link for earlier. I'll post it again for anybody that came in late. I have a document out there that I put together with audio visual tips for video meetings. It's got a lot of good information about testing connections, testing microphones and video camera, how to get rid of an echo in a meeting, those kinds of things. So I encourage you to take a look at that. And I'll grab the link and share it again in the chat.
Thank you, Susan. That would be really good. Any other questions?
Steve here, Richmond.
Go ahead.
Thank you. This is a really timely meeting for me. We're in the throes of getting ready for Hurricane Isaias, and the thinking in region was to ship a ton of equipment to a chapter in the area. And I take it that's not going to happen that way.
Well, it depends on the operation. I mean, but in the reality with today's COVID environment, we really need to use the tools that we have and the technology that we have to be safe and to work efficiently and smarter. So that's up to the management and with the doc. They're going to have the conversation there.
I really appreciate it. They're envisioning opening 40 shelters. I think that's probably a maximum. My guess would be 5 to 10. And I'll take this offline. But
yes, you can feel free to reach out to us. Lee, you have your hand up.
Yeah, and just to add to the point that I made earlier about trying to link the equipment ordering with both RMS, local regional deployment team, or regional the regional deployment team, the mass care teams, the shelter management teams are under the impression that they have some role in terms of making direct requests for hardware. That one I kind of dismissed as probably unrealistic, but if that's something, Chuck, that you can verify or unverify, that would also be helpful.
Sure thing, Lee. And like I said, with that spat of tornadoes that went across the Southeast earlier during this environment, we had several different operations that were all very different from each other. We actually set up networks in a hotel or a couple of hotels in Chattanooga where we had DST personnel on the ground doing stuff and distributing some hardware. It was very limited because we're talking about, while typically mass care doesn't have a lot of use for that except as you go up to the leadership levels. There were health services, physical and mental health involved who did have a need for certain equipment. And so it's going to vary. We had some other tornadoes that were going on simultaneously in other states from South Carolina all the way across the Gulf Coast. And we had no requests for equipment, even though we had mass care operations. We had non-congregate hotel shelters. So we're still working through all of this with RMS. To my point earlier, it's evolving as we speak. And we'll keep you guys posted as we find out more. But we will circle back with RMS to make sure that we're aligned on expectations. And
remember what everybody learned in the DST 101 training, that flexibility is the most important skill, right? I think we should wrap up, but Tina, I did notice earlier, and I don't know if this question got answered, somebody was asking how do they get a hold of the spreadsheet that you shared?
I answered that we will send it out to the DST lead along with all the other information that they might need.
When they get deployed.
When they get deployed. Also, we have, because again, we're developing it's working. It's work in progress.
Yeah.
Also, realize that this is all us all working together and things that work and don't work, we don't know. It's all brand new for all of us. So, you know, we do welcome comments and suggestions, and flexibility and open communications. Those are two keys to success. All right.
Yep, absolutely. Well, thank you everybody for showing up. I knew we were going to get some questions that weren't about software, but I didn't know they would almost all be that. So thank you so much, Chuck and Tina, for answering those questions that I would never have been able to answer. And I just will remind everybody we have another event next week. Steve Bonine is helping us lead a session on how to deal with multiple team memberships and not be overwhelmed by being invited to too many teams. And he'll even show us how to get into more than one team's meeting at a time if you're in a session, maybe where you have a breakout session or something like that. So it should be interesting. You'll have some time to practice that. And we look forward to having all of you show up next week and learn more about teams. Thank you.
And just real quickly,
yeah,
Susan,
go ahead.
I see there were just a couple of questions come in. If you could go ahead and email those directly to Tina, we'll get some responses back to you. I'm sorry that we're out of time. Just want to say thank you, everybody. I know this is challenging in this current environment, but good seeing you guys. Looking forward to working with you over the season, either remotely or seeing you in the field. So take care, everybody, and thank you.
Yep, thank you.